A quick disclaimer before we begin. The PEMF podcast does not contain any medical advice, and the content provided is for informational purposes only. If you have any health concerns, please visit a healthcare professional. Welcome back to another episode of the PEMF podcast, and today we are joined by a leading voice in the hyperbaric oxygen therapy, or HBOT space. A chiropractor, functional medicine practitioner, and author of Oxygen Under Pressure. That is Jason Sonners. We will cover how HBOT works, as well as the benefits, how stacking it with PEMF, as well as other therapies to enhance it, and so much more. But I'm really excited about this episode because we brought up HBOT quite a number of times on the PEMF podcast before. I'm a massive advocate for it, absolutely love it. And if I had space at my house, I would definitely have one. So this might be the podcast that pushes me over the edge. But for anyone who hasn't seen you before, Jason, if you could just give us a little bit about your background and what you're doing in the HBOT space, what brought you here?
Sure. Yeah. So, I've been in practice for about 21 years. I've been doing hyperbaric oxygen for almost 20 of those years. I got into it more or less, I'd almost say by accident. I actually had an injury myself. I had some nerve damage that just wasn't getting better doing all the other things that I had already known how to do. I was at a conference, not that dissimilar to the one that, where we were at Health Optimization, but, something like that, where they had hyperbaric chambers and they were doing demos. I actually had no idea what it was at the time. I had no intention of, even ever using one or buying one. It looked interesting to me, so I wanted to give it a shot. And I did about a 20-minute session and got out, started walking around. And it was about 10 or 15 minutes later that I started getting almost pins and needles in my foot. And that was really the first time I had felt my foot since, a year and a half prior when I originally had the injury and the nerve damage. And I thought, wow, am I getting this sensation because of that experience? And so, that led me to talking to them in more detail, led me to trying a few more sessions while I was at that show, which brought me to purchasing one and utilizing it at home and treating myself. And, within a few months, getting, full recovery from that injury. And, from there, I still didn't know that I was going to use it in my office or use it for patients, let alone, do all the things at this point that I've been doing. But I started experimenting with some family and some friends that had some issues that each time consistently showed, incredible changes. And so over time, I brought it into the practice, started using it more and more. It became a foundational component of our, general clinical experience for, I'd say, most patients at this point. And over the time, I realized that even though we had been doing it, there still was a huge gap in the industry where it was a difficult therapy for most people to find. A lot of practitioners didn't understand it and felt like it was a daunting device to add to their office. There's still, a lot of misinformation around hyperbaric oxygen. And so that's really where I started, getting into the research, developing curriculum, teaching hyperbarics, teaching even the practice and the business behind hyperbarics to try to make it, easier for practitioners to want to utilize it, because I knew that would be a way to really get access for more and more patients who would benefit from using it. And so, that's here we are today. I think we've trained over 650 practitioners, and we've helped to open a few dozen different clinics. And it's been a great journey.
No, it's really cool. So, how long ago was that first trade show that you went to and you saw that? And you mentioned that you did like a 20-minute session, which I understand is kind of like scraping the surface, really, isn't it, with a session? So, and you still got benefits from that quick time using it?
Yeah. So, I mean, that show was about 20 years ago.
Wow.
So, at that time, people were still like hyperbaric. What's that bariatric machine you have?
Yeah.
Hyperbaric was not a common, even now it's still, I think, not as common as it could be, but, certainly back then it was like completely foreign. I would say that to get really meaningful changes for most people, even when I talk to patients, I tell them, please don't expect much, at least for the first 5 to 8 hours. there are certain things that I think, or certain people, I should say, that may respond sooner. I would consider myself very lucky that a 20-minute session actually stimulated some, at least the sensation change that, I was aware of that kind of brought me back to trying more. I think I did about maybe 3 to 4 hours over the course of that weekend in that where I saw some more significant changes in that time. But it wasn't until I had one, brought it home, and like I said, I mean, it took a couple, at that time, that was a 1.3 chamber, so soft chamber, and it was air only. And so, knowing what I know now, maybe if I had added some oxygen to that at that time, I would have seen some changes sooner. But, within a few months, as I said, I had full recovery. And so, that's pretty standard. I'd say 20 to 40 hours is kind of the average of what most patients are going to experience in hyperbarics, depending on what their goals are.
Yeah. Okay. So if I think back 15, 20 years, I was doing my PADI diving course and learning how to dive.
Sure.
And at the dive center I did that, they had a hyperbaric oxygen chamber. And until maybe 5-10 years ago, I only associated hyperbaric oxygen chambers with dive centers.
Yes.
So what do you think has changed in the industry, and why are we seeing these in people's homes now? Is there a difference between the ones that are in the dive centers?
I mean, the biggest difference essentially would probably be the pressure that they go to. In a diving center, most diving chambers are going to be 6 atmosphere chambers, meaning they can go 6 times the atmospheric pressure that you and I are getting right now.
Okay.
Most clinical chambers might be 2 to 3 atmosphere chambers. So pretty, even in the hard chambers are usually significantly less pressure. And then soft chambers could be like 1.3, 1.4, sometimes 1.5. So, a fraction of the pressure.
Yeah.
What I would say, hyperbaric definitely evolved in the diving industry. That's certainly where it got its, beginnings. And specifically for, the bends, decompression sickness, decompression illness, things like that. It was really through, I would say, research and interest for, the early adopters of hyperbaric that they saw, other, let's say, like the wound healing and, some of the early carbon monoxide poisoning, it was like, hey, we use it for diving medicine, but there do seem to be a few clinical reasons why hyperbaric might be useful. And so research really developed in more of a hospital setting. And so, we have in the US, there's about 15 approved indications. Outside the US, it varies anywhere between like 6 and 10, approved indications, meaning, the governmental agencies think that it's useful for X, Y, and Z. And, but across the board, most of those are really what I would consider to be life-threatening or limb-threatening. In other words, someone's about to die or lose their vision, lose their hearing, or lose a limb. And in those cases, hyperbaric is often used as like a last effort to try to save, either save someone's life or save that limb. In many cases, it's effective in doing so. And so we went from diving medicine to, let's just say, severe and acute disease. But once we understood why hyperbaric was helping with those diseases, it wasn't, in my opinion, because it's a real treatment for the disease, as much as there's a handful of mechanisms of action that hyperbaric is just really consistently delivering. So some are mechanical effects, which is really the dive medicine and like crushing nitrogen bubbles and helping someone with decompression sickness. But the other mechanisms have more to do with immunological effects, mitochondrial effects, and then tissue regenerative effects. And so there's a lot of research in hyperbarics on certain infections, on certain illnesses, on certain like non-healing wounds or radiation burns, things like that. And when we really look at that research, we see that the way that it's helping someone who's very sick, recover from this issue are the same reasons, quite honestly, that you and I might use it. And so this device went from, dive medicine only to very severe condition to really just understanding that most of us need a boost of our immune system or a reduction in inflammation, or most of us need improved mitochondrial function, or, most of us desire some type of tissue or cell regeneration, especially from like a optimization or performance standpoint. And so it's really just, this tool is one of the only ways to deliver oxygen at a level exponentially higher than what you and I are getting right now. And prior to somebody going into a hyperbaric chamber for the first time, they've been limited to how much oxygen their body can carry based on atmospheric pressure and red blood cell carrying capacity. And hyperbaric is the first time that human would have experienced 2, 3, 4, 10, 12, 15, 18, 20 times the amount of oxygen that they've, been carrying their whole life. And all of a sudden, that surplus of oxygen carries with it a series of impacts that everybody gets to experience, no matter what their goals are or what their health concerns are. And with that massive increase in oxygen, we see some pretty incredible benefits, whether that's getting someone from sickness back to, let's just say, asymptomatic or at least get away from their diagnosis, or to take someone who is moderately healthy and say, hey, I really want to optimize myself. Oxygen is a critical ingredient in that entire continuum of health.
Okay. I'm very guilty in taking people too far into the technical side.
Yeah.
And I want to take a real step back.
Sure.
And I just want to ask you, just for anyone that's tuning into this episode and has absolutely no knowledge on what hyperbaric is before.
Sure.
What is hyperbaric oxygen therapy, and what does it typically look like?
So it's important to understand that the reason that you and I are breathing right now and actually pulling oxygen out of the air we're breathing is because there's an atmosphere. That atmosphere provides a pressure, and the pressure of that atmosphere is what drives oxygen, once we breathe it into our lungs, into our circulation, so that red blood cells, which are the type of cell that carry oxygen, can bind to it, carry it throughout our body, and then deliver it to our cells. When we go up in elevation, like, for us in the US, if I went to Colorado, a higher elevation, a higher altitude area, we find that it's harder to breathe. And we say that there's less oxygen at altitude, but it's not really that there's less percentage of oxygen. So whether you and I were at sea level or we were at the top of Mount Everest, the air we're breathing is 21% oxygen everywhere on planet Earth. The reason it's harder to breathe at elevation is because there's less pressure. So as you leave the Earth's surface and go to the top of a mountain, go hiking, or go to an area of higher elevation inland, we lose pressure. And as we lose pressure, we lose the driving force of oxygen from our lungs into circulation. Hyperbaric is the exact opposite of that. So what hyperbaric is doing is it's creating a temporary increase in atmospheric pressure. And as we increase the surrounding pressure, around our body, we can drive exceptionally higher levels of oxygen into circulation. And so that's really all it's doing. We could add oxygen to it, or we could just breathe air. Both would still deliver a higher amount of oxygen than what you and I are getting right now. But regardless of what you're breathing, it's really the pressure that makes it work, because oxygen will follow the pressure gradient that we're creating inside the chamber.
So if we deliver 100% oxygen to me sitting here on the podcast to you, it's not going to be used by the body the same way it would be under pressure and inside a hyperbaric chamber.
Like most of us have gone to the doctor, they've put I have one, a pulse oximeter on your finger, right? And as long as you're, and you stick this on your finger, and as long as you're moderately healthy, you should be 97, 98, 99% saturated. And so that's the maximum red blood cell carrying capacity. And so if you were 98% saturated, let's just say, and you had 100% oxygen and a mask that you put on your face, you can go from 98 to 100 but you could never be more than 100% of anything, right? So right now we are both limited to how much oxygen we can carry based on the pressure and red blood cell carrying capacity. When you go into a chamber and you increase the pressure around the person, or sort of increase atmospheric pressure temporarily, you're actually bypassing red blood cell carrying capacity. And now you're dissolving oxygen into the plasma of the blood at levels that under normal pressure would be impossible. And now the plasma becomes a reservoir of extra oxygen that's really an enormous reservoir, depending on how much pressure somebody's exposed to, what percentage of oxygen they're breathing while they're in there, and then how much time they stay. Those are the three variables that really help to saturate the plasma to become this reservoir of excess oxygen.
No, it makes sense. That's really good. So how long can these benefits last? You've mentioned what happens to the cells and the difference between using it under pressure and not under pressure. Typically, how long will those benefits go on for if someone has done an hour in a HBOT?
So there's two ways to look at that. One would be, to some extent, how long does the oxygen stay in circulation and how long does somebody benefit from that exposure? And then there's, because you've had over a series of sessions, you've had this change in your biology, essentially in your physiology, because of a number of sessions back to back, what kind of benefits or changes happen from that? So, essentially what I would say is most people, again, it depends on pressure, percentage of oxygen, and time, but let's just say that, the oxygen that we get could stick around maybe 4, 6 to 8 hours max. 8 hours later, you're pretty much back to baseline. But that doesn't mean that those benefits stop. It's like, that's how long the oxygen lasts. But now it has stimulated a number of changes. So in the short term, you can say that it stimulated an increase in mitochondrial function, which means essentially an increase in your cell's ability to make energy. So you'll have, let's say a day or a day and a half worth of increased energy production. It'll stimulate your immune response. So it'll stimulate your immune system's ability to fight infection. And so you can get, a length of time of that benefit. It'll also start to reduce inflammation pretty quickly. And so those are some of the short-term benefits. But in the long term, it actually stimulates things like increased size of the mitochondria. In other words, like, let's say you had the mitochondria to me is like the engine of the cell. So let's say you had a car with a small engine. Well, imagine because of oxygen exposures, that engine would grow in size, like a 4-cylinder to an 8-cylinder. Well, that's, you're capable of making a lot more energy if you had an 8-cylinder engine versus a 4-cylinder engine. If you kept exposing someone to oxygen over a longer period of time, instead of having, let's say, one engine, you could have 2 or 3 or 4 or 6 engines. And so another benefit of repetitive exposures is, at first, the mitochondria will grow in size, but next, the mitochondria will actually start to replicate. And now you actually have more mitochondria per cell, which is going to be capable of an exponential increase in energy production. But long-term also stimulates things like new blood vessel growth or new collagen growth and soft tissue repair, like ligament, muscle, tendon repair. It also mobilizes an increase in stem cells. So in the short term, like 1 hour to 3 to 5 hours, there's just like those mitochondrial or inflammatory and immune system benefits. But once you've hit like 15 to 20 hours or more of therapy over time, you start to get changes in cellular repair that you keep forever. Once you grow new blood vessels, they don't go away after you've grown them. Once you've increased mitochondrial function, a lot of that sticks with you. Once you've mobilized stem cells, you get a repair in terms of like cellular repair or tissue repair that you get to keep forever or until it gets injured again or whatever the case is. So there's a range of benefits based on how much exposure somebody has over a period of time.
Yeah, I think that's a great analogy in the way you've explained that as well, because similar to PEMF, we normally tell people the results last about 8 hours. people are thinking, well, what's the point in doing it every single day if I'm only getting 8 hours of benefit rather than 24 hours? But like you say, the effects it's having in the body and on the cells during that time are lasting a lot longer, and the benefits of that and increased sleep. And, you know, if people, because I've used a HBOT a couple of times, and the sleep I got afterwards was just unbelievable, you know, like falling into a new level of deep sleep. And that in itself, you know, the repair that happens during that time is incredible.
Right. So the oxygen is gone in that time, but you can't ever discount the benefits and the recovery that you got from that sleep. Exactly right.
Yeah.
That's a great way to say it.
Yeah. So is there, I know this is a hard question to answer on the PEMF world as well, but is there a particular condition that you see more, either that HBOT benefits, or that you see more people coming through your doors with that condition because they want to use HBOT? You know, is that something you can answer in terms of just something that you see such a turnaround a lot of times with?
Yeah. I mean, I would say that we don't really specialize in any one particular area of health or disease. We really are open. When somebody comes to us and we're trying to decide, is this a good therapy? Is it appropriate? What's the protocol going to look like? Is it going to be safe? Those kinds of things. My first question is always, what are you coming for? What's your goal? And I need to answer, do I think hyperbaric is going to help you meet that goal? Because the last thing I ever want to do is waste anybody's time or money, And so because hyperbaric, like PEMF, I mean, these are systemic therapies that aren't really, even when I teach this to practitioners, I'm like, we need to get away from the treatment of disease.
Yeah.
Because none of these things are ever going to be classified as like the successful treatment and cure for X, Y, and Z. But I don't even want it to be classified that way, because it isn't. It's giving the body the chance to do what the body does by itself, which is the body's what's in charge of healing. All right. There might be something interfering with that process. Something's missing that if we gave it to the body, it could utilize that to heal, or the body might be getting exposed to something else excessively that's interfering with the body's ability to heal. But either way, it's the body's ability to heal, which is what we're trying to tap into, right? So if that patient gets better, it's not because Jason did anything so amazing or that I'm responsible for it. It's just that we're trying to offer, a way to get rid of excessive toxicity, essentially, and to get exposed to things that you might be deficient in, and create an environment that allows that body to heal itself. And so that being said, though, yes, people come in, they say, I have X, Y, or Z, will you treat me? I have MS. Is this a treatment for MS? I have cancer. Is this a treatment for cancer? And I'm very careful to say that, we have patients with MS who we see. We have patients with cancer who we see, or post-stroke or anything like this, but not because it's a treatment for you. It's really a supportive therapy that allows your body to, again, heal more efficiently. And so for us, though, the people that respond, I'd say the fastest and most significantly, I would say people with a variety of different autoimmune issues. And I think the reason for that is because hyperbaric is so effective at reducing inflammation and rebalancing the immune system. And then I would say neurological issues, like everything from, children with developmental delays or on the autism spectrum, all the way through, MS, post-stroke recovery, and even neurodegenerative disease. The brain makes up about 2% of our body mass, and it uses 20 to 24% of all the oxygen that we breathe. And so it's incredibly metabolically active and needs a lot of oxygen for function. And so we do see that neurological issues respond incredibly well to getting an increased level of oxygen, whether that's from a healing standpoint and a recovery standpoint, or really even using oxygen as like a cognitive performance enhancing tool.
So a few people I've spoken to about HBOT, and because I've said to them in the past that I've had amazing results using them. They say to me that they would never want to get in a chamber because they're claustrophobic. Is that something you get quite often? Because usually I say to them, you've just got to try it, just got to try the benefits. But they're like, well, I can't be put into a tube and either zipped in or, locked in for an hour. It's just not in my capacity. Is there something you say to people or help people through that roadblock?
Yeah. And this is just an opinion, so I'm not trying to hurt anybody's feelings out there. Having been doing this for nearly 20 years, we've treated thousands and thousands of people inside these chambers. It is something I hear a lot. It's something that most people feel there's probably a continuum of that experience, but it's a thought that a lot of people do express. And I would say this. There's probably on the very far range of that continuum, there are people that legitimately claustrophobic, like they have a real phobia of being in closed in spaces for sure. And maybe those people, aren't likely going to go into a chamber, but I would also say that those people aren't also calling my office, right? So I tell a lot of practitioners, if they're calling you, they already have a thought in their mind. They're nervous, but they must not be like the absolute far extreme of that story, because they wouldn't even call you if they were. Mm. But even inside of that, there's a lot of people who still express that concern. What I find in a lot of those people is that as we show them how the machine works, we show them how they could operate the equipment all by themselves if they wanted to. We basically hand the control back over to them. And that a lot of that experience isn't just the amount of space that they're given. It's almost like the fact that they're in this thing and they don't know if they wanted to get out, how would they get out? And do they actually have their own control to get out? Mm-hmm. And so if we take our time with those people, walk them through it nice and slowly, not push them at our speed, but allow them to experience the chamber at their speed. And I hand the keys back to them and I'm like, this is how the thing works. Open this, turn this, do that. Essentially, in most chambers, they could do everything from the inside that we do from the outside. And then I just say, listen, but even though you could control it yourself, I prefer that you don't. I pay my technicians to take care of you. They take their job very seriously. They love to take care of people. Just let us know you want to get out and we'll get you out. And people that are a little bit more nervous, we even do some trial sessions where we let them come in. They close the door, they open the door, they turn on the machine, they shut off the machine. We just let them get a little bit more comfortable with the device so that they're a little less nervous. And that seems to, in 20 years and thousands of patients in a variety of different chamber, styles, there's literally only 3 people that I can think of that wouldn't go into the chamber.
So just for my own benefit, one thing when I was in the chamber before I forgot to ask was, if you're at full pressure, how quickly, if someone wanted to get out, could they get out? Because my understanding is they still need to decompress slowly and safely, but is that a process of 20 minutes or is that a couple of minutes, or can you literally hit a button and pop out?
So, when we're doing this, just to go back to the claustrophobia conversation, when we're doing this with somebody who is nervous, we pressurize that chamber exceptionally slowly on their first session or two. That way, if they have a panic moment and want to get out, we could open that door literally in a second. Mm-hmm. And part of that's also to help gain some, trust and rapport in the process. Anytime we've had somebody panic, that panic would have been in the first minute or 2 minutes or 3 minutes. It's not like you got to full pressure, you're 45 minutes into a session, and all of a sudden you're having a moment. That I've never actually even seen that. I've only seen it be in the earlier stages. So we sort of create an environment that allows us to build that trust over time. But to answer your question, for most people at full pressure, it really also depends on what pressure you are at. But in most environments, you could get out in a minute or 2 minutes at most and still do that very safely. It wouldn't be the most comfortable decompression, but it wouldn't be dangerous. In most situations, we travel at about, we use PSI, pounds per square inch, but, if somebody was at, let's say they were at 2 atmospheres, that's about 15 PSI. And we would travel at about 1 to 2 minutes per PSI. So we do usually go slowly, like 15 minutes to get out from the chamber at 2 atmospheres. That's not for safety purposes. That's strictly for comfort. But from a safety standpoint, you're also required to be able to go from the highest pressure that you are treating someone to door open, patient out in 2 minutes or less. And so that's just a safety requirement for running a chamber. But again, yeah, you could get out pretty quickly. A soft chamber, I think I've gotten out of in like 28 seconds, which I think is pretty fast. But, again, it's not super comfortable, but it's not dangerous.
And I don't want to labor on the kind of, sticking points of getting in and out of chambers, but there was one more question that I wanted to just cover because I know it's something that comes up quite a lot, and that's ear equalization and pressurization and things. Because, like I mentioned before on this podcast, I've done a PADI and I'm quite experienced in equalizing my ears. But my wife in particular, when we go on airplanes, she really struggles, and she's verbally said to me before, I'd never get in a HBOT because I can't equalize my ears. Again, is that something that have you got techniques that you can easily train people to do that? And, or will it eventually just pressurize if they just do nothing?
So, if you went slow enough, you could probably pressurize and almost keep it under the radar. Like the body would just slowly equalize on its own. And we've done that in really severe cases where it's like, we'll take 20 to 30 minutes to get to full pressure. Sometimes we've done that with kids, like they just don't even understand how to equalize. And so we just have to kind of sneak it in. The key is to not get scared whenever possible or to not hurt anybody. Because if they're already nervous and then we're pressurizing them at whatever pace we want to go, and now they're getting uncomfortable, it's even painful, like it's never going to work. And so my rule is you should never have pain inside the chamber. And if you're having discomfort and it's becoming painful, we have to bail because it's just never worth pushing through that discomfort. Risk to benefit ratio becomes a problem.
Okay.
I spend a lot of time with new people coming in for their first dive. We spend a lot of time going over, a range of 6 or 8 different equalization techniques. And again, for most people, we can get it done. There's very few people that I've ever had that really just can't equalize. And those are usually, they've had ear surgeries and there's a lot of scar tissue in their tympanic membrane. And so it's just really not flexible. Outside of that, using a number of different techniques, we've been able to get almost everybody through there. And then not only do they learn how to manage the chamber, but then airplanes become, easier and other areas of equalization. And after the first few sessions, the tympanic membrane starts to become more flexible. And so if you can get somebody in on their first session, even if it means that you don't go to full pressure, you get halfway to pressure, you stay there for a little while, you come out. Next session, you go a little deeper, then you come out. Next session, you go a little deeper. Even just doing it that way allows people to have an experience that, gets them to adapt to the change in pressure more easily and more comfortably. And then, we don't tend to have those issues going forward.
And any major contraindications, people that absolutely cannot get in a chamber or?
Yeah. If you can't equalize, you can't go. That's rule number 1. And rule number 2 would be pneumothorax. So someone with a popped lung cannot go. If they've had a pneumo in the past, but it's fully recovered, than they could. But an active, untreated pneumothorax. And that's really it. I mean, there are some other, relative contraindications that require, a conversation and consultation, but those are the only two real absolute contraindications.
What about pacemakers? Because that's something we can't use PEMF with. So that's our absolute no-no is a pacemaker. Are they generally safe in HBOT, or again, is that one of the gray areas?
So it's not really gray. In general, anything battery operated is a conversation. Mm-hmm. And so for different reasons, like you got, in PEMF, we're utilizing electrical impulses and we don't want to interfere with another electrical impulse, right?
Mm-hmm. Yeah, exactly.
With hyperbaric, it's just that batteries are also pressure sensitive. So that's on the relative list, and it just means that we have to check with the manufacturer and make sure that the battery is rated for pressure.
Yeah.
And what pressure it's rated for. So, if it's rated for 6 atmospheres for 6 hours, going to 2 atmospheres for 60 minutes is not a problem at all. It's basically that thought process.
Okay, cool. And with this kind of shift in HBOTs being kind of only used in professional settings, and like myself, I'm quite keen to buy one for my home. Do you think that's a good thing, having devices at home that people are using themselves, or would you prefer that they're used in a trained environment?
I usually would want people to at least partially, just because these things are not inexpensive, right? So, I hate for somebody to go and buy a chamber, turn out that they don't like it, or they're having trouble using it, and then they just have a really expensive clothes hanger that they throw all their laundry on or something. So a lot of times I would try to get somebody to use it, go somewhere, use it, have an experience, have a number of sessions, just to know if it's something that they're interested and likely to utilize. And when it comes to like soft chamber usage, I'm a big fan of people using chambers at home. Mm-hmm. I don't love how frequent it's becoming to put hard chambers and higher pressure at home. Partially because I think a lot of people think that more is better.
Yeah.
And now they're just treating themselves at much higher pressures than are necessary. And 2, because you could do almost everything wrong with a soft chamber, and the risk to benefit ratio is never terribly skewed, towards very dangerous. As you go up in pressure, the risks become exceptionally higher. And without really knowing that or understanding that becomes a bigger concern for me to have. And, especially because people try to, if some is good, more is better. And now they're treating at high pressures frequently without really knowing or understanding any of the risks and or benefits of different pressures. That I don't love, quite honestly. But, I've even had a number of people who've put higher pressure chambers in their home actually take our courses because they understand that there's a higher level of risk. That way they're at least becoming more educated on what that ought to look like. But
I think it's a really important point, because exactly the same in the PEMF industry is that people think that if they spend £40,000 or dollars on a PEMF device, they're going to get the best device. They may not necessarily be getting the best device for them at home. They're getting a super high intensity product that is better suited in clinics and has some more risks associated with it of overuse and things like that. So it's an important point, because I'm also this podcast is really educating me. It's great because for someone that's possibly looking in the future of getting a HBOT at home, my view again is more expensive. The hard shell is better. It's it's got all these different benefits, but if it's going to be used on a more frequent basis and in a safer space, then maybe I don't need to spend £50,000 on one.
Right.
But we're still talking about $10,000 when we're talking about the soft shell at the bottom end, really, for a good chamber. So these are expensive bits of kit,
right? And for a lot of people that are building out mini optimization centers in their home. Right? It's also one thing if, let's say, Hyperbaric was the only tool you had. But in many cases, for people doing this kind of thing, it's not, right? They have they've gotten a PEMF and they've gotten maybe some hydrogen. Now they're getting a chamber. They're going to get a sauna. It's like, the other thing too is like, once you start understanding the synergy of these different modalities and tools, you don't need the highest, strongest, most powerful individual modality, because now you're really honing in on synergy. And when you're honing in on synergy, you can really get a lot of benefits from each one of these devices, and even more so because you're creating some amount of stacking with other technologies that are all different, but they all have some overlap that makes, magnifies the benefits of each one when used together.
Yeah, which perfectly brings me to my next question, which is, our listeners will know all the benefits of PEMF therapy, may not know the benefits until this episode of HBOT, but they really, really work amazingly together. And when everybody asks me, what other therapy works well, we normally point people at red light, because PEMF and red light is good, work together. But the most powerful for me really is PEMF and HBOT, because of the benefits of separating the cells and things. So what's your take on using PEMF and HBOT and the benefits of stacking those two? And what's your kind of protocols when it comes to that?
Yeah. And quite honestly, HBOT, PEMF, and red light is like, to me, sort of the triple exposure that, magnifies each one even more. So I'm in full agreement with what you just said with regard to that. Mm-hmm. There are certain things they're going to have in common, like all three of those devices have an impact on, let's say, total systemic inflammation. Mm-hmm. All three of them are going to have impact on energy production. All three of them are going to have impact on some immune system, applications. But all three of them are doing it from three totally different angles, right? So there's overlap with some of the result. But what I would say is there's almost no overlap between the pathway that each one of those devices is getting to that result. And the reason that that's important is it's not redundant. In other words, like if somebody's goal was to reduce inflammation, as an example, you could say, well, hyperbaric reduces inflammation, PEMF reduces inflammation. I already have a PEMF mat. I don't need hyperbaric. But when you actually understand that, even though they all three will reduce inflammation, understanding that the pathway is so different tells you that the effect you're going to have is not an overlapping effect. It's actually a magnifying effect. If I can reduce inflammation here, here, and here in three different ways, then the total anti-inflammatory effect is going to be exponentially greater, because we're addressing it through three different pathways. And so I think that's an important distinction to make, to help people understand that that's really where synergy becomes so incredibly powerful and beneficial when utilizing a number of technologies, together. For me, we usually would do, when I'm using hyperbaric at lower pressures, let's say 1.5 or below, we typically would do PEMF first, red light second, hyperbaric third. And for me, that's just like if I was looking at what the cellular responses are, and I was trying to basically pave the way for each therapy to maximize the impact of the previous therapy, so to speak. When we go to higher pressures, again, oxygen at much higher pressures has additional benefits for some people, but there are some additional risks. And so because of that, I swap the red light and hyperbaric. And so I still would typically do PEMF first, hyperbaric second, and then red light third. But the other thing I say to people is if we're limited to the number of sessions we're going to do, in other words, someone came to me and they were like, listen, I'm only going to do 10 sessions of all of these devices. I think the order could be very important. But if somebody's using these like you or I might, in terms of like, building programs with specific goals and with the intention of utilizing these therapies for like years on end, I start to think that the order becomes a lot less important. In other words, if you're getting PEMF on a pretty regular basis, if you're getting red light on a pretty regular basis, and you're getting hyperbaric on a pretty regular basis, you're going to get the benefits of all of those, and you're going to be getting the synergy of all of those, and you're going to be getting that for, hopefully months and years on end. I start really relaxing on like the firmness of the order, the timing, just knowing that, these are just, each one of these devices is very powerful on their own. Mm-hmm. And so as long as over the course of months and years, you're getting hours of this and hours of this and hours of that, and you're really supplying the body with those ingredients on a quasi-regular basis, you're going to get the amplifying effect and the synergy by doing so, for sure.
Yeah, no, it's a really good way of explaining all that. One other thing time is obviously a massive constraint for a lot of people, and hyperbaric oxygen is, it's a long time. It's time consuming. Yeah. It's the quickest time you probably get in and out of a chamber is an hour. Is that kind of really, for a good session or? Yeah.
There are times or reasons, particularly like on a performance standpoint, where like 30 to 45 minutes might be appropriate. But I'd say the international average of session across the whole world is probably 60 minutes. Yeah.
Yeah. So is there an argument to stack them all at the same time? And it's a question I wanted to ask you actually, because the old school hyperbaric chambers where the whole thing would be filled with oxygen, the risk of people taking phones, the electronic equipment, all that sort of thing was complete, out the window. But now we see Gary Brecker in his hyperbaric chamber, sitting there on his laptop, speaking to people on the phone, that sort of thing. First of all, really my question is, the newer hyperbaric chambers now, is that okay, advised, it's you can use them? And if so, can we bring PEMF devices in? Can we bring red light devices in and do them all within that hour?
Here's what I'll say. When it was 100% oxygen environment, it's a 100% zero tolerance for anything that could go wrong. Because when something goes wrong, which is incredibly rare, it could be catastrophic.
And just for our audience, that's, the old style was to fill the chamber with 100% oxygen. Now what we do, I believe, is it's nasal. So we're breathing in high levels of oxygen, but it's not necessarily filling the whole chamber. Is that correct? That's
correct. And it's not necessarily the old way or a new way. Like chambers have always either been pressurized one way or the other. And in the US, there's still quite a bit of 100% pressurized chambers. But what I would say is that the real issue isn't, or the reason that chambers or that batteries couldn't go into chambers was not the percentage of oxygen. It's because a lot of these batteries are sensitive to pressure changes.
Okay.
So just like if you went, you flew to the US to go to that show in Austin, when you pack something under the plane, one of the first things they ask you is, do you have any lithium ion batteries in this bag? Because you are not supposed to put lithium ion batteries under the airplane. Why? Because there's excessive pressure changes that the luggage compartment goes through. And two, because if there was a fire in the luggage compartment, there's really nothing you could do about it.
Yeah.
In the cabin, and years ago, we used to hear about a phone here or there catching fire on an airplane, even in the cabin. And again, that's because using the phone creates heat, and because pressure changes heat the battery up even more. We see a lot less of that today than ever before, but the fact remains that lithium ion batteries especially are pressure sensitive. So I still stand by the fact that we shouldn't be doing that. Electronics in the chamber that are low voltage and running from a power source outside the chamber is one thing. And that's always been something that chambers have been used and doing, which is totally okay. But I get...
Is there a way of running the wires then outside?
Yeah, you can, right.
From
totally.
inside to outside?
100%.
Yeah, okay.
Yeah. And so if we're, back to PEMF or other things, like if we're running something from an external power source and it follows the regulations of what, voltage and amperage are allowed inside of a chamber, those could be yeses.
Mm-hmm.
But I don't love the idea, and I still stand pretty strong. And we teach that consistently when we're teaching these courses. Batteries and chambers just don't get along very well. Now, if that battery, let's go back to pacemakers for a minute. If that battery was tested at 6 atmospheres for 60 minutes, and you're only going to 2 or 3 atmospheres for 60 minutes, it's good to go. Mm-hmm. But the fact is when it comes to a lot of these devices, like phones as an example, the newest iPhone has been tested for 6 feet of seawater for 30 minutes.
Mm-hmm.
Even a soft chamber goes to about 10 feet of seawater, and you'll typically spend about an hour in there. So you can't say that something that's been tested at 6 feet for 30 minutes is good to go for 10 feet at 60 minutes. You know what I'm saying?
Yeah.
But if we started to do that testing, we could certainly have a different conversation. But right now, nobody's really been willing to take on the liability associated with, testing these things and making a statement, though a lot of the chamber manufacturers just tell people it's okay. Now, one of the things is let's just say you had a battery issue inside the chamber. If it was pressurized with air, is that chamber going to blow up? No. But are you still stuck in something that you can't get out of immediately and there's a fire? Yes. And so that's really why I'm still such a stickler for this conversation that way.
Yeah.
But going back to like the stacking of the therapies, I would also say this, like sometimes, depending on the goal, but sometimes when I'm using, red light, the power density of that red light might be really important.
Mm-hmm.
And putting that power density inside the chamber is probably not going to happen. Or if that power density also, elicits a lot of heat, it's not comfortable to be inside the chamber and be really hot. It's not like you want to be doing a sauna at the same time.
Yeah. Mm-hmm.
And so for those reasons, I tend to not do them or even look for opportunities to do them at the same time. I look for opportunities to say, all right, well, red light could be a pretty short exposure. I'm going to do that, this morning before I get ready for work. PEMF, I'll do, midday right after this interview, I'll go lay on my PEMF mat, for a little while. And then tonight, before I go to bed, I'll jump in my chamber, wind down, relax, and let it get me ready for like a really good night's sleep. I tend to maybe look for separations because I'm trying to get the most out of each one sometimes in that way.
Yeah, in the different protocols. That's good. And that's one of my questions actually was kind of, would you necessarily have to do one immediately after the other, or could you spread them out?
I think spreading them out, again, especially if it becomes part of a program where you're doing this on a regular basis, you're still going to get the synergy even when we spread them out,
Okay, cool. Again, kind of coming back to that question before, is in types of if you're recommending a protocol of PEMF, red light, and HBOT, is there anyone that you think would be the most beneficial for that? So maybe they haven't responded to the HBOT, they haven't responded to PEMF, but you want to kind of hit them from all the different angles. Is there a category that you would say that that's going to be most effective for using all three?
Quite honestly, most people. I think is the answer.
I think that's
If you're possibly carrying, I often talk about like a plant analogy where like it's a long story that we probably don't have the time to go through the whole thing, but essentially, plants need sunlight, they need water, they need nutrition, and, they need to not have toxic soil as an example. Mm. And, if that plant has toxic soil, it doesn't matter how much water and sunlight and food you give it, it's still going to be sick. Or, if that thing is not getting the right amount of sunlight, but it got all the water it needed, all the right nutrition, it had clean soil, it's still not going to do well. Like a plant needs what a plant needs in order to express health.
Yeah.
I don't view us any differently than that. We have a certain requirement for healthy living. There's a voltage to all of our cells. There's an electricity to our nervous system's ability to communicate with neighboring and nearby cells. There's an electric component to our ability to contract muscles, right? So there's a whole chemical, electrical component to our body. And if we're not capable of carrying the proper, voltage and ability for self-signaling from an electric standpoint, or if we're disconnected from our grounding source, which most of us are, like if we're deficient in, I'll just say electricity for the lack of a better way to say it, like there's no amount of hyperbaric that's going to correct that. If we're light deficient, which most people are, there's no amount of PEMF that's going to fix that, or hyperbaric that's going to fix that. If we have hypoxia issues, which again, most people do, either from toxicity or chronic inflammation or both, like there's no amount of red light that's going to fix the hypoxia. So quite honestly, to me, these are like foundational, necessary ingredients that as an organism, we need the right amount and type of electricity. We need the right amount and type of light. We need the right amount and type of oxygen, just like we need exercise and proper nutrition. These are foundational to health, period, end of story, non-negotiable. Now, some people may need one or two of those more so, and somebody else may need one or two more so than somebody else. But essentially, unless you're creating an environment that these humans are getting all of the right ingredients for a period of time, they really only work better together than they would individually for so many people.
Yeah. I think that's so important. Like you say, the three pillars of health in there are oxygen, magnetism, and light. And it's three elements that if we didn't have one of those, eventually we would die, we would decompose. So it's and the world we live in, which is something I say a lot of, quite frequently, it's so toxic because of all the different radiation that we got around us. I tested my blood to see what happens after 10 minutes of one of our PEMF devices. And I was expecting to see a good sample versus another good sample. And I tested it and it was a really bad sample, which worried me, and I thought, I'm classed as a UK biohacker. Why is my blood so sticky? And it was because I tested it at 4:00 in the afternoon after I've been sitting on my ass for 8 hours and in front of all this Wi-Fi where I'm sitting now.
Right.
It has a reverse effect. We're not exposed to sunlight right now. I'm not exposed to good levels of oxygen. I'm not moving. So the world we're living in is undoing all this good. And what a lot of this tech is doing is just reinforcing that and bringing it back into what we need. So, that's why what I believe is why disease is skyrocketing at the moment because of, pretty much the world we're living in.
Right. Like, some people say like our ancestors didn't have hyperbaric and they were fine. I'm like, yeah. And if we lived in that world, we wouldn't need it either. Exactly. I don't want to substitute tech for what we ought to have had exposure to in the past, or say that the technology is critical and humans can't be healthy without technology. I don't believe that to be true at all. I believe that all the technology that we're using is literally just to undo the consequences of, the current world and lifestyle that we've all been sort of, tricked into believing that we need it.
Yeah. Exactly. That's the thing. And it's being realistic, isn't it? If me and you said, right, from tomorrow, we're going to go and live in a cave and we don't need all this technology, how are we going to feed the family?
Exactly.
So it's just being real, isn't it? And using this tech, safely to kind of bring these things back into our lives.
That's it.
You mentioned about the hard and the soft shell chambers. and where you kind of would see better suited at home. Have you got a couple of key differences? Because there's a big debate in the HBOT world. You know, is a soft shell any good? Is it worth even investing in? Are hard shells better because they go down to lower, that sort of thing? Am I right in thinking that if me as a HBOT user, if I'm going to go to a clinic and use it once a month, I want to get down as low pressure as possible in a hard shell, and maybe at home I'm using a soft shell at lower pressures? Or am I completely on the wrong track there?
I recently did a whole research study on high pressure versus low pressure. We ran a bunch of people through it and trying to answer that question, because that's the most common question I get. And I can't tell you that the results of the research I did are like written in stone and this is like the permanent answer. You know, it only stimulated even more questions, quite honestly. But in some areas, what we found was there was similar impact at lower and higher pressure, in which case we can make the argument that if you're using lower pressure over a longer period of time, you should have a similar impact. In other cases, we found that higher pressure did have certain effects that lower pressure just did not have. But on the flip side, we also found that lower pressure had certain impacts that higher pressure did not have. And so really what that is now it's opening up a conversation of like, there's not one size fits all programming. And even if you had access to a high pressure chamber, that doesn't mean it's the right one for you. Or just because you have a chamber at home doesn't mean you should never get exposure to higher pressures periodically. And I think what we're figuring out now is that different pressures are having a different impact. And just like everything else we could say the same thing about PEMF, right? There's different frequencies of PEMF. There's different intensities of PEMF, right? And
exactly.
Similar questioning and similar research down the road and similar answering of like, in some cases, all of it's going to get us to the same place. And in specific instances, different versions may be very important to create certain pathways. And so we're still in the beginning of understanding that, but any bit is better than none of it. And I think that's true of light and PEMF and oxygen. And the sicker you are, or the bigger your health concerns are, or the loftier your health goals are, I think the more specific you need to become with regard to like, let's say, which pressures over which periods of time to get the responses that you're trying to get, And I do a lot of work with people and clinics trying to maximize the protocols to make sure that people are applying it as closely and accurately as we can based on the information we have today.
No, that's great. And that helped me understand as well, HBOT, because like you say, it's a common question we get in the PEMF world as well is, the debate is always, is low intensity or high intensity better? My answer to that, someone that's been using PEMF therapy for 15 years, is both. My protocol is I use a low intensity every single day and I use a high intensity probably once, twice a week because of the benefits that the two of them both give. And the body can get used to certain things. It's throwing different ones in there, its ability. So if you have access to, is a simple answer to that, low and high, a mixture would be a good protocol?
Yeah, and that could be because you have a range of pressure options at home, or that could be because you're doing soft chamber at home, but periodically visiting a clinic to get some higher pressure exposures. There's a couple ways to mix and match that, but yeah, I think I view, and I'm sure you do the same based on what you just said about, different devices and PEMF. Like I view all of this through the hormetic lens and understanding how to basically create a varied the same way I vary my exercise is the same way I vary my nutrition, is the same way I vary my hyperbarics. It's the same way I vary my sauna. It's the same way I vary my, higher dose red light exposures and my PEMF. Like constant and never ending variation amongst different strategies, protocols, and devices over months and years is going to be the way that all of us get the most out of any of this process.
Yeah. Okay. No, good. And when it comes to oxygen purity, what do you think is more important, the pressure or the oxygen? Because a lot of people are sort of saying that their oxygen is more pure and they have better, better source of oxygen. And is that more of a marketing thing, or is it really important to have like good oxygen?
Yeah, I mean, it's important to have good oxygen. You don't want bad oxygen, but you know, is one person using green tank medical grade oxygen? Someone else is using a concentrator. Somebody else has a concentrator that's 92%. Somebody has a concentrator that's 96%. You know, for the most part, I think the answer to your question is that's a marketing thing. And you know, I've seen people who say certain things but can't prove what they're saying to be true anyway, which is incredibly frustrating for someone like me. But I would also say that like the amount of oxygen isn't always the most important piece, right? So pressure's doing something, oxygen's doing something, and time is doing something. And really, once you understand what you're working with, okay, this is the pressure ranges that my equipment goes to. This is the oxygen ranges that my equipment goes to. And this is the amount of time, frequency, duration that I have to play with. You can pretty much make a protocol based on whatever you've got, I think, in most cases. But I don't know that that's quite honestly like the most important component. I don't think that it is.
Okay, cool. And we're seeing these 4-person chambers popping up in like sports clubs. You know, I actually used one, a place in London recently. Are they just as effective as, I suppose it obviously depends on the manufacturer of the chamber and things, but do you think if you got a good quality 4-person versus a good quality 1-person chamber, are they just as effective, or is there other constraints in terms of more pressure, more area to pressurize and all that sort of thing?
Yeah, I mean, there are other constraints and size of compressor, and then there's what's your oxygen source, and do you actually have enough oxygen flow to feed 4 people the same way you would have fed 1? And I've seen a lot of equipment out there that falls short of really meeting the standards when they start doing that kind of thing. But if you had good compressors and you had powerful oxygen sources and you could essentially deliver the exact same program or protocol in either environment, the impact should be identical at that point. But I think for me, like we have a number of chambers in our clinics that we run, but I've never put them, those are called multi-place chambers. I've never used a multi-place chamber because it's rare for me to think that I have 4 people that need the same program.
Right, yeah.
So like if you have a 4-person chamber, everybody's going together to the same depth for the same period of time. Whereas I might have somebody who needs 2 atmospheres. I have somebody else that needs 1.5. I have somebody else that's doing 1.3. I have one person coming for 60 minutes. I have 2 people coming for 90 minutes. You know, I don't, from a clinical standpoint, I tend to steer away from the multi-place for those kinds of reasons more than anything else. But if it were important to have multiple people going to the same destination for the same period of time, and you were able to create those environments, there shouldn't, and you're getting the right, clean air, good air turnover, the right amount of oxygen for each person, therapeutically, it should be identical.
Yeah, okay. And I saw a debate on Instagram with people saying that there's a cross-contamination risk as well with people in multi-chambers. Obviously, if you're in the same room as somebody, there's a cross-contamination risk, but is it emphasized at all being in
only because it's such a small space typically, and depending on how quickly the chamber is like refreshing new air. Some chambers are called static chambers, and they're not even refreshing the air on a regular basis. That's a whole different potential for something like cross-contamination. But it's certainly a conversation.
Yeah. Okay, cool. Last question for you. Any common myths or misconceptions with HBOT that you kind of want to just
There's almost
debunk?
More myths and misconceptions than there are not myths and misconceptions.
Right. Any that you hear most on a daily basis?
Yeah, I mean, so first of all, I have a YouTube channel with about 600 videos on hyperbarics, and hyperbarics mixed with other tools, devices, strategies, all kinds of things. And I think we have a few playlists that are like myth specific for that reason.
Mm-hmm.
So if people are really wanting more detail on that, I think that'd be a great place to check out a lot of the myths and misconceptions. I think the more is better is one that just drives me bonkers, and I wish people just had a different view of the world. But that one's really incredibly important because there are so many people that are going to be doing a lot more higher pressure, more frequency, and more duration than they need. And I think there's consequences to that, which are unnecessary.
Yeah.
Another one is, how about I just breathe oxygen at the surface instead of using the chamber, which, without pressure, the oxygen just doesn't work. So or not in the way that it would with the pressure. And so that's a really important distinction to make. Another one is EWOT. EWOT, I love EWOT, which for your audience is exercise with oxygen therapy. And they've done a great job marketing themselves to be like a cheaper and faster hyperbaric. But it's not hyperbaric. I love EWOT. I think it's incredibly powerful, but the way that it works and what it does and the reason that it works are completely different than the way hyperbaric works, what it does, and why it gets the outcomes that it gets. So I think that's an incredibly important conversation that like a lot of these things are great and are compared to one another, even though they're vastly different. And really the comparison is apples to oranges, not apples to apples. I guess the last one would be that like, it's the cure-all, the magic bullet, and it's just not. It does help so many people with so many different issues, but not because it's the treatment or cure for anything, strictly because oxygen is such a critical ingredient to the healing and recovery of our body. And for a variety of reasons, mostly toxicity and inflammation, lead to low oxygen environments at the cellular level, which means that, delivering high levels of oxygen for those people becomes such an amazing amplifying effect for healing and recovery. But again, not because the treatment is the treatment of that condition, strictly because oxygen therapy at those pressures delivers that ingredient at such high level that the body's now capable of healing in the way that it needed to in the first place.
Amazing. Thank you so much. I mean, thank you for your time today as well, because I've learned so much on this and I'm definitely going to go and start looking at buying a HBOT now.
Yeah. Well, secretly, once you said that, I was like, you know what? My goal today is to get you to.
yeah. I'll send you a picture in a couple of weeks of me and my.
I want to see what you come up with, but
100%. Okay, cool. If anyone wants to find you, where's the best place to start? So if they want some training, if they want to know a bit more about HBOT or read into your book, where can they start?
I've written 4 books, 2 of them on hyperbaric specifically. One's Oxygen Under Pressure, which is more of like a general understanding of hyperbaric, and one which I co-wrote with Dr. Dottori, which is The Art and Science of Hyperbaric Medicine, which is a little bit more of like a practitioner-based book. Like almost, I don't want to say too much detail, but it's a lot of detail unless you really want that level. HBOTUSA.com is our main website. We don't sell anything there. It's strictly like educational for the average person to better understand hyperbarics. HBOT USA is our YouTube channel. Also, like I said, there's 600 videos for people to learn there. And then the HBOTcourse.com is where we actually sell trainings. That's like where our education training on business consulting and certification courses all live on the HBOTcourse.com.
Excellent. Thanks a lot. We'll leave some of those links under this podcast as well.
Awesome.
But for our audience, thank you again for listening to today's episode. If you've enjoyed it, please subscribe, leave us a 5-star review, and on any of your favorite streaming platforms. It really helps us bring people like Dr. Jason Sonners to share their knowledge with you. Like I say, before this episode, my knowledge of HBOT was kind of there, and now it's through the roof. So
awesome.
Thanks again.
Yeah, man. I love being here, and happy to do it again in the future as we learn more and grow. You and I. I'm sure we'll have new things to share with one another down the road.
Yeah, definitely. Bring you back for part 2.
Exactly.